Hi, I'm Kari.
Hi, I'm Jurence.
And I'm Sammy.
Today we are going to talk to you about the Nurse Practice Act and nursing shortage and work overload, and what are some solutions to those problems. Starting with the Nurse Practice Act, some historical highlights. In 1910 was when the first Nurse Practice Act was created for Massachusetts. In 1911, the first state board of examination for registered nurses was established with a fee of $5. In 1919, the first renewal was established for registered nurses with a fee of 50 cents. And 1958 is when registration for nursing became mandatory. In 1983 is when the NCLEX replaced the state boards. And in 1994 is when they use computer technology for the testing. 2001 is when there was the duty to report as a registered nurse. So what exactly is the Nurse Practice Act? So the Nurse Practice Act works together with the state laws and regulations to guide and govern nurses' practice within the state. The state has a duty to protect those who receive nursing care, to ensure that there's safe, competent nurses practicing on the public. The Board of Nursing is responsible for enforcing the state's Nurse Practice Act and nurse licensure to promote safe and competent care. They are also responsible for accrediting or approving nursing education programs, developing state standards of practice, formulate policies, administrative rules and regulations, as well as addresses violations to the Nurse Practice Act. Every nurse in the US is responsible for knowing their state's Nurse Practice Act and regulatory requirements for nursing for every jurisdiction that they hold a license for. Since laws and regulations are constantly evolving, it's important for the nurse to also stay up to date on those laws and regulations for each state that they hold a license for. And they can find those on the Board of Nursing as well as the NCSBN website. So violations to the Nurse Practice Act involves unsafe or incompetent nursing practice that puts the patient at risk. Some of these instances can include being impaired by drugs or alcohol while working, stealing from patients or their family members who are visiting, and that could include medications that are supposed to be administered, providing treatment or care that should be provided only by a physician, nurse practitioner, PA, or advanced practice nurse, falsifying records, boundary issues, including abuse on a patient, either physically, verbally, or sexually, not following accepted standards of practice while caring for patients, and being involved in criminal conduct. So what happens when a violation has occurred? So many states have mandatory reporting, and nurses may be required by law to file a report of any instance of unsafe practice or misconduct by a nurse to their Board of Nursing. Most states do require a written or signed description of the act or behavior that has been reported. Many times, the identity of the complainant remains protected, although if someone is a key witness to the misconduct in question, they may be asked for more information that would be needed for the case. So after a complaint is filed, there are a few steps that are taken. First is the determination, which is made whether or not the acts were violent or against the laws and regulation of the Nurse Practice Act and the state laws. There is an investigation that is held within the Board of Nursing, and interviews are then conducted. And then there's a proceeding. So the nurse is given the opportunity to respond to the allegations and present his or her side of the story. The Department of Public Health, when information from a complainant investigation indicates that a licensee has violated a law or regulation relating to the particular profession, the licensing board may take administrative action against the licensee, and each board has its own regulations and practices related to discipline. Discipline actions they range from a letter, remediation, education, discipline, or their license can be reprimanded, revoked, or they may go through a probationary period. These are just some links that you can access directly to the Mass laws and regulations in nursing, how to file a complaint, and where to access the Mass Board of Nursing.
Okay, so now we're going to move into nurse shortage and overworked nurses. The nurse shortage can be felt nationwide. There are many contributing factors to why nurses today are in such high demand and why there's an actual shortage. We are dealing with a nurse shortage crisis, and it's projected to only get worse. Here in Massachusetts, we have a law for critical care nurses that was put in place in 2014, stating that nurse to patient ratio should be 1:2 or 1:2, depending on stability of patients, and that is in the ICU. There's some facts about the US nurse shortage, and in 2035, 10 states are projected to have a shortage of registered nurses. And Washington is projected to have the largest nursing shortage by 2035 with a 26% shortage. More than half the current RNs are over the age of 50, which would mean that they will be retiring. In 2021, the US nursing schools had to turn away more than 91,000 qualified applicants due to lack of faculty, education space, and resources. In 2020, when the pandemic began, nurses were pushed to their limits. Many hospitals did not have enough PPE for their staff, and the ratios of patients to nurse was outside the nurse's comfort zone. The pressures, demands, and mandate of overtime and exposure burnt nurses out quickly. By the decline of the pandemic, healthcare workers were retiring early, resigning, or finding alternative work. Higher staffing numbers would mean less nurse burnout, better patient care, and would create a positive environment for both the patients and the staff. Let's talk about nurse shortage, overworked healthcare members. As many of us know, the ED wait times are higher than normal right now. Entire units have been closed down. There's no space to put patients who are sitting in the ED waiting for rooms. Patient-centered care is suffering because of this, and the added cost to healthcare systems, such as provider's office, travel nurses, and telehealth, is putting more stress on our healthcare, and everyone's education then suffers. Here's a video explaining to you a little bit more in depth about the nurse shortage.
Good evening, everyone. Welcome here to ABC Action News at 5:30. I'm Paul LeGrand. Florida's medical workforce is facing a major shortage of nurses and support staff. And today, industry leaders calling on lawmakers to take urgent action. Capitol reporter For Saunders tonight following the developments from Tallahassee.
During a panel discussion today, the heads of various health and hospital associations put out that call for help. They say the Delta surge didn't create the problem, it just made it worse. Teresa Gates runs a home health service managing nurses and caregivers and says her operation is in crisis mode.
We don't have enough staff to take care of the patients that need it.
It's the same for nursing homes and hospitals across the state. The summer surge over, but a nurse and support staff shortage just beginning.
We have to have all hands on deck. How do we handle it? How do we look at this as a national crisis? Because it's a national crisis.
Her concerns echoed by this industry panel Monday.
We are in a major crisis. We need solutions.
Hospital and healthcare associations saying the shortage will get worse without help. Pandemic burnout, early retirement, and low wages fueling the problem.
Sometimes getting people to all agree that there is a problem is part of the problem.
Mary Mayhew runs the state's hospital association. Her group believes Florida will see a nurse shortfall of near 60,000 by 2035. Mayhew hoping next year lawmakers will help avoid that.
We just need to make sure that there's a sense of urgency as we go into this legislative session to adopt some strategies that really help to provide some relief in the short term.
The wish list includes ensuring Medicaid funding meets cost of care, leveraging state agencies to track and evaluate workforce data, plus adding more teachers and sign-up incentives to nurse and CNA ed programs. Lawmakers haven't yet offered anything touching those big goals, but there's plenty of time before the 2022 January session begins. Meanwhile,
I'm one of those that says, please do something.
health providers like Gates wait and worry. Gates also worries about the impact of vaccine mandates. She thinks that it might force terminations and exacerbate the situation, although plenty of others say that vaccine mandates are worth the risk as they boost shot rates and help the health and safety of everyone. That's the latest out here at the Capitol. I'm Forrest Saunders reporting.
Okay. So I'm going to be talking about some solutions. We cannot just throw out all these problems and then not propose some solutions that we came up with. So the first solution, like we saw in our discussion earlier in the semester, was the nursing staff ratios. And the only state as of right now that has established this is California. So these are their staffing ratios at the OR and ICU and emergency room. So it's kind of a little bit varied. So this is what they have at their staffing ratios in those different department units. So before we go on, I just want to lay a little bit emphasis on this. Why is staffing ratio important? Because staffing ratio is important because it saves life. We cannot undermine that fact. It also prevents incidents from happening. Patient satisfaction increases with staff rate, safe staffing. Ratio reduces nurse burnt out. Ratio saves money. Ratio works. This is just an illustration of what one person, this is an example of overstaffing or over. The ratio is not balanced. So here is a nurse trying to serve so many patients at the same time. Just that picture, let's have an image of what is going on. Now, the proposed federal RN ratios, this is what they're proposing. As of right now, this is information is from the National Nurse United website. This is what they're proposing. We hope it goes through. That at the ICU, we have 1-2 or 1-1 at the new NICU as well. At the operating room, obviously, it can only be one patient at a time. And then at the ED, for example, we have a nurse to 3 patients, and so on and so forth. Another solution is offering student loan forgiveness programs for nurses. If we do this, and then we'll have many more nurses or nurse aspirants coming into the program. What is a student loan forgiveness for nurse? Is when the nurse get their college student loan debt debt forgiven by the federal government or state-based programs. So if you have, as a nurse, if they forgive your loan, definitely you are encouraged or motivated a little bit to stay, and that will go in the long run to reduce the nurse shortage as a whole. So this program often requires that a nurse hold a specific loan type. It's not just a one brush paint all. There are certain categories of loan types that if you qualify, you can have the loan. So on this slide, we have about 6 of them. The next slide could give us a little bit detail into them. So for example, if I qualify for the Nurse Corps loan repayment, or to qualify for that, you have to help, you have to be an RN, APRN, or a nurse faculty with student debt and a degree from an accredited school, and you work in a CSF or teach nursing. So you have to look at what fits your status. There are many student loan forgiveness programs for nurses out there. The public service loan is a little bit different. The qualifications for that is a little bit different from the Perkins loan cancellation. So the Army Nurse Corps benefits, these are some of them. And then we have the Advantage Faculty Loan Repayment Program. We also have the National Health Service Corps. So if you like, at the end of this presentation, you can ask our group, and we'll be more than happy to share this information with you, to give us the details with them. But for time's sake, we will not read all of this. And you can look them up too at Army Nurse Corps or Disadvantage, just the names, you can look them up yourself. If not, we are more than happy to share this, to give the slides to you at the end. Yeah, these are still more of those forgiveness programs and how to qualify for them. All right, solution number 3 is hospital tuition reimbursements. So national and state loan repayment programs aren't the only options for nurses. Individual hospitals across the country offer assistance in paying off student loan debt from nursing degree programs too. So a hospital, in keeping their staff, they come up with programs to encourage their staff to stay with them by paying off, or by coming up with programs to pay off their student debt, or just reimburse them if they are continuing education. Another solution, like I mentioned previously, if you're continuing education in a facility you're working at, some facilities don't go behind to give you the forgiveness, but they may give you some discounts if you're doing continuing education. They can reimburse you 100%, or they can give a discount. And then sometimes you have to work for them for like a certain time. You have a contract with them. It just depends. So there are so many ways that health institutions are coming up to encourage the issue of, not encourage the issue, but to help ameliorate the issue of nurse shortages. So we also have a new, the one that we really hear now is a new higher sign-on bonus for nurses. And we've heard that a lot during the COVID period, but it's still going on. Like if you're picking up a job with a company, a hospital, there is always like a sign-on bonus, a package for you. And usually maybe you work after 6 months and then you receive your package, or you work after a year, but then that is an encouragement just to make you sign, just to give those sign-on bonuses is an encouragement to nurses. And it goes a long way to help with the shortage crisis. There is also extra shift bonuses for nurses. So for example, those who are working like per diem, they only have a certain number of hours that they can give for a month. Say they can work 2 8-hour shift a month. But if they do add anything above their commitment, they have extra shift bonus. That goes the same with those who are working, say 32 hours a week. If they do something extra, they always have extra bonuses. This, no matter how we see it, this really encourages people to keep working despite the crisis that is going on. And it does encourage non-healthcare workers to get into the healthcare field as a whole, just to benefit from this bonus system. Another solution is to sponsor teachers and faculty. Nursing schools are receiving federal financial assistance to hire more instructors for the future nursing workforce. It's been on the rise now, the shortage for nursing teachers as well. So they are also receiving federal assistance in various schools. Solution number 8, we want to sponsor teachers and faculty. Okay, this is a little bit similar to what we just saw, but then nursing schools are receiving federal financial assistance. Much of that help comes from programs run by the Health Resources and Service Administration, the division of the U.S. Department of Health and Human Services. So there are 5 scholarship loan programs offered by this division. It includes health professions student loans, scholarships for disadvantaged students, students for disadvantaged, loans for disadvantaged students, nursing student loans, nurse faculty loan programs. So if you are interested, like if you want to do your master's in education or anything, or if you want to become a teacher, or you know someone who already have masters or have all of this, but they are not encouraged in working as a faculty member, these are some of the programs that if they are made aware of, they will be encouraged. And they will be encouraged to come back. And this will go a long way to reduce the shortage crisis that we have. Oh, great. Solution number 9 is the balance the gap in race and gender nursing wages. This is a sensitive one. Like, I'll just look at the figures. You see what a white male will earn compared to what a female will just earn. So if there is that balance in the salaries, all these people put in the same work, the same energy, and if they feel like they are discriminated because they are female or because they are of certain races, that discourages people that makes nurses to leave. But if there is a balance in this gap, in this wage, in these payments, then people will be encouraged to stay. Like, why not? Solution number 10 says create standing bodies to document. That's a bit on my side. Create standing bodies to document and advise on issues of recruitment, training, and retention. Whether we like it or not, nursing shortages is a huge crisis. It didn't start because of COVID. It was there before, but COVID era made it so prominent because nurses were stretched out, just like Sammy said, nurses were burnt out. So what do? Do we keep just having the nurses look for solutions themselves, have hospitals run crack their heads to look up for solutions themselves? What if the government steps in by creating a standing body that regulate this crisis? Given how significant nurses are to the lives of millions of Americans, Factors affecting the likelihood that individuals will enter, stay in, or leave the nursing profession requires constant monitoring and response. The permanent body must be authorized to document the state of the nursing workforce and advise on policy solutions to address challenges. This body should be able to connect and respond to both pipeline and education issues, as well as matters of workplace conditions. So these bodies should help not just nurses, the education itself, the process, because many students drop out from nursing education, nursing students drop out from the education program because there's so many things to be regulated. If we have a body just working along the lines of this, then it will go a long way to help with the shortage crisis. Wow. So at the federal level, that was the state level. At the federal level, Congress should fund the National Healthcare Workforce Commission, initially authorized by the ACA in 2010. A fully staffed and funded National Healthcare Workforce Commission could work in tandem with healthcare workforce professionals, educational institutions, payers, researchers, consumer representatives, labor unions, workforce development boards, and federal agencies, such as the Health Resources and Services Administration, to document and advise on the state of the healthcare workforce, particularly nursing, and will be critical in times of high demand for healthcare professionals. So this is only saying that we should not only put those bodies at the state level, we should also do it at the federal level. And we are calling on Congress to do something about this. I will not read all of that, but if you need more information about this, you can reach out to our group and then we will give you more insights. All right. Since I'm the last to present, I'm just going to read the summary for this. It says, nursing shortages have been a component of American life for years. Yep. COVID-19 pandemic is just one of the many times that the United States battles to keep an adequate nursing staff. Key investments of federal financing and lasting coordination are needed to lessen the impact of nursing shortages and improve the nation's ability to respond. If legislators at all levels reason single-mindedly about solving the nursing shortage and improving racial equity, more workers will have equitable access to a high-quality, well-paid profession. More patients will have equitable access to high-quality nursing access, and a healthier people will have better education and life outcomes and be able to build sounder communities. So these are some of the works cited by all of us. Like I said, if you need more information, you can always reach out or you can always refer to this. And the presentation was done by Carrie, King, Sammy. Oh, sorry, I'm reading out your last name. I love your last name. Sorry. Carrie, Sammy, and Durance.
So Kari, what are some standards of conduct and responsibilities?
That is an excellent question, Sammy. So on the screen here that I've shared with you, you'll see some of the Massachusetts standards of conduct according to the Nurse Practice Act. Nurses must practice under a valid license, comply with laws and regulations related to nursing, act within their scope of practice. Nurses must wear an identification badge with their full accurate name, as well as their license information, like if they're an RN with their BSN, ADN, if they're an LPN, so forth. Some of the mandatory things that nurses must practice in the state of Massachusetts is reporting death, reporting abuse on a patient or resident, and that includes children, elders, or disabled individuals. They must pay taxes, child support, safeguard patient dignity and their rights. You'll see a list here of things that nurses should not do, such as discriminate, borrow from patients, practice under the influence of alcohol or drugs. The full list here is open for you, and there's more information available on the Board of Nursing website or the NCSBN website, which I've provided links for, and I'm happy to send that to anybody that's interested. There's also guidelines as far as what responsibilities and functions are for a nurse and what can be delegated and what cannot be delegated. Here is a full list. And again, this is just kind of a condensed list. There is much more that is listed on the Massachusetts website as far as rules and regulations. Endurance, as far as the great solutions that you provided us, have you seen any of these solutions played out within clinical or your experience in the healthcare field?
Oh, yes. Actually, that is working because I know of certain institutions, even in my personal experience, where the bonus system, for example, really works out well. Like people are able to give more than their commitment because of the bonus. So, for example, if you're supposed to give two shifts or 4 shifts a month, they're actually flexible with the hours. It's not like fixed, but you can give 2, 4 shifts or 8 shifts. But if you are able to do anything beyond that, they still give you a bonus, which is quite encouraging. We find many people giving in the more hours because of the bonus system. And I also, it's my understanding that at the ED, where I am a student, when I do my clinicals now, the ED, they always send these little text messages to the workers, like, can you come in, and the extra shift bonus, if you come in today, it's like 1,000, or yeah, and then people come in just because of those bonuses. So it's really good. And this information goes around, and many aspirants, people who are not thinking about the nursing field, they do come in. It helps. It goes a long way. So yeah, it works. That bonus system is one of them that I can think about right now. That's a good question, Carrie. Thank you.
Thank you.
Yeah. So Sammy, in your clinicals or experience, have you seen some incidents of these shortages or burnouts that you make mention of, for example?
Absolutely, Terrence. I have, yes. For example, at Holy Family, where we do our clinical, we rotate down to the emergency department, and the emergency department is actually overwhelmed with psych patients, mental health, and there's a mental health unit upstairs that is completely shut down because there's a shortage of nurse staffing. So they cannot use that floor at all, and the patients are held in the ED. There's then patient care is then lacking because the patients in the waiting room have to wait extended periods of time for a bed to open up to take care of them, and the nurses are overwhelmed. So there's definitely a shortage of nurses at Holy Family, and it causes not only a problem for the nurses, but it definitely takes a toll on the patients as well. Their care is not what it should be, and the patient times of waiting in a waiting room, I mean, I can't tell you how many times I've seen patients just walk out without care because the ED is overwhelmed with medical psych patients.
Okay.
That's great, Sammy. Thank you for that information. And if anyone is interested in accessing any of the links or information that we've provided with you today, you don't hesitate or feel free to reach out to us, and we'd be happy to provide you with that information.
Thank you.
Thank you.
Thanks.